Hello, everyone. I'm Jason Tokarski.
And I'm Megan McGurman. Welcome to For the Love of Health, brought to you by ChristianaCare.
When you go to a doctor's appointment, do you know every member of your care team? Of course, there's doctors, nurses, medical assistants, but have you heard of a community health worker?
Community health workers at ChristianaCare are an integral part of many care teams, helping patients navigate the healthcare system and beyond.
To tell us more, we're joined by Manager of Community Health Impact, Erin Ridout, and Community Health Worker, Briana Nkwenti.
Briana and Erin, thank you for being here today.
Thank you for having us.
We're thrilled to be here.
Community health workers are certainly not a new concept, specifically here at ChristianaCare, but there are definitely people listening who are hearing about this work much more in depth than they ever have before through this episode. Talk to us about how you explain what a community health worker is to a patient hearing about it for the first time.
I simply say I'm the bridge between the patient and the healthcare system. That bridge can look like me making appointments for patients, helping improve health outcomes, addressing chronic conditions such as hypertension, diabetes, connecting them with community resources such as transportation, or connecting them to local pantries such as the food bank or local churches. So oftentimes I explain it to patients like this. You're the driver, I'm the passenger with the GPS, and oftentimes we'll switch. Driving gets tiring. But either way, our destination is the same. We're both here trying to improve health outcomes and improve your overall lifestyle.
They're really trusted members of the community that they're connecting with. And so they're kind of relationship experts, right? They go in there, they connect with the patient, and then that's how, through that relationship, that they're able to do those things that Briana just outlined.
And Erin, there are dozens of CHWs here at ChristianaCare. Briana's in primary care, but your team is based all throughout the health system. Give us an overview of all the different pockets within Christiana that have a CHW.
ChristianaCare is one of the largest CHW employers in this state, and so we've got CHWs in primary care, we've got CHWs in maternal health care, supporting people throughout their pregnancy care journey through postpartum. We've got CHWs who specifically support individuals who are accessing behavioral health or mental health services. We've got CHWs that really focus on how to manage chronic conditions through nutrition, so food as medicine. We also have CHWs who support individuals who are at the Hope Center, so individuals who are kind of transitioning from that hospital care back to the community, and that CHW plays a really critical role to making sure they can safely transition home.
The work of community health workers isn't just important to ChristianaCare, the organization itself. ChristianaCare has made an investment statewide of $26,500 into community benefit funding to really get this certification program up and running. So, Erin, tell us a little bit more about what that contribution has meant to the program and to the community.
It's really significant. There have been efforts in the state of Delaware to launch CHW certification, which is really around kind of standardizing that professional development, making sure CHWs have kind of the same level of skills and understanding of the valuable work that they do. And those efforts have been going on probably since 2010, maybe even earlier. And after hitting several roadblocks, ChristianaCare came to the table and said, we are willing to give half of the money and get matched by the Academy of Medicine to get that funding that was necessary to launch the certification. And so that funding goes towards reducing the application fee for all CHWs who apply for certification throughout the state of Delaware, and really launching and building that workforce. I think in addition to that large investment that ChristianaCare has made, ChristianaCare partners really intentionally with several community partners around the development and the uplifting of the CHW workforce in Delaware. For example, there are CHWs who specialize in domestic violence who work with Child Inc. Those individuals come to ChristianaCare for medical care, and then that community-based CHW can collaborate with our ChristianaCare CHWs to really wrap that patient up in support. So when Christiana supports its own CHW workforce, it really is supporting the state's CHW workforce.
So far, this has been a very big picture, statewide conversation. Let's bring this back down. Briana, you're doing this day to day, talking to people on a daily basis. What is it like for you, and how do you help those people, meeting them where they are with what they need on that daily basis?
I have many patients that have a lot of different needs. On a day-to-day, that looks like me calling the patient, and just asking, hey, how are you? What are some things that you are currently working on, or what are some immediate needs that you have? And so patients would tell me, hey, I don't have, my benefits ran out for food. I no longer have, access to food. So I would go to maybe the food bank or one of the local churches and pick up a food box for the patient. Or a patient may say, hey, I have an upcoming appointment and I'm not sure how I'm going to get to my appointment. We really work hard trying to find resources for these patients in the community. Within Christiana also, our local state agencies and organizations.
I'm sure you have had hundreds of patients in the years that you've been doing this work. Have any of these patients stuck with you, or you think about sometimes as real victories of patients you've helped thrive?
Yes, I do. In primary care, we tend to look at those patients as family. I have patients that call me just to check in to see how I'm doing, or patients would just call me and just update me, hey, my A1C went down, or I lost this weight, or I'm down doing like this yoga class or Pilates. And honestly, it's inspiring. It really makes me reflect on the work that we do and how it impacts our community. Recently, I was working with a patient, I want to say back in October. Originally, I had met the patient at the office. He was seeing his provider for the first time. He was establishing care. And his provider pulled me in and was like, hey, I think this patient could benefit from this program. So immediately, I sat in and I listened to all the things that the provider wanted the patient to do. Originally, he had an A1C of 11.3, which is pretty significant. So after the appointment, I followed up with the patient doing home visits. He's also a business owner, so his time was very limited. So I had to get creative and be very intentional when it came to meeting the patient. So often I met him at his business and I went over his healthcare plan. I asked him, are we getting our labs done? Are we getting our healthcare preventative services done, such as his colonoscopy? It took more than just me. It took his provider, it took the specialty care, it took the pharmacist, like adjusting his medications. It took the office staff. Everyone is included in his healthcare.
Let's dive a little bit deeper into that concept of everyone being included. This is a real team effort, it sounds like.
It really is. Community health workers aren't just a nice to have, right? They are a critical member of the care team. And so Briana and CHWs like her are really working within the system, working with the other members of that care team to make sure that our patients have the best outcomes that they possibly can. And I think one of the things that Briana just highlighted, right, it's not just supporting kind of a busy clinical care team, it's also supporting a really busy patient. Right? Our patients' health really happens predominantly outside of our healthcare walls, and that's where those CHWs are most valuable as members of the care team. They're in the community where that health happens, truly supporting that patient around whatever their needs are to make sure that their clinical care needs get met.
Of course, that level of trust and that knowledge kind of only gets you so far, because there's always going to be some kind of a roadblock, something that makes it more difficult to offer the kind of help that you're trying to do. What are some of those roadblocks you've run into, and how do you get around them?
I make sure that I'm very clear with patients, letting them know that this is what I'm going to do at this time. I'm going to follow up, just making sure that we're on one accord so that the patient isn't anxious or nervous, wondering did I follow up or did I schedule this appointment for them? It's really, can I trust what you're doing and can I guarantee the outcome?
And I think that, we have CHWs supporting these patients not just with their barriers kind of in the community, but also just barriers navigating a complex healthcare system, right? And so there might be barriers around reaching the right person to make the right appointment. But the CHWs know who that right person is, and they know how to reach that person and confirm that appointment. And then the barriers that the patient is experiencing out in the community, the CHWs are really skilled at overcoming those barriers as well. So whether that's transportation, childcare, getting a prescription filled, how to access the food resources and the community resources that are available. There's always this constant Teams chat or constant communication among the CHWs around, hey, did you see this resource? Do you know about this resource? And so with the number of CHWs we have, the reach around knowing what those resources are is really great. And they collaborate and they share those resources to the benefits of our patients.
You've clearly already done a ton of work in the community, getting this program out there and to as many people as you can. But there's probably plenty of people who've never heard of this before. What is your message to somebody out in the community who's just now hearing about this now?
My message would be, we're doing the work, we're building resources, we're on the way. These programs that we're building, these relationships that we're establishing within the community, we're here to support you.
There are people out there who would make great community health workers, and ChristianaCare is a great place to work as a community health worker. And so if you're naturally good at building relationships, if you're able to work well with a variety of people, then community health work might be the right job for you.
Erin and Briana, thank you so much for your time today.
Thank you.
Check out the show notes for this episode for more information on ChristianaCare's community health workers.
And make sure to keep up with For the Love of Health on social media. Just search for ChristianaCare.
We'll be back in 2 weeks with another great conversation.
Until then, thanks again for joining us
For the love of health.